Gartner dust cyst. Definition: a Gartner dust cyst is a benign vaginal cyst lesion that arises from the Gartner's duct, which is a vestigial remnant of the mesopharyngeal duct in female. They are typically small, asymptomatic cysts that occur along the lateral walls of the vagina, following the course of the duct. Medical applications. In general, these types of vaginal cysts usually have no symptoms. Routine gynecological exams will be and explain about the signs symptoms that the patient may have as pain in sexual relations, and that most of the cysts are benign. In the case of an infection of the Gartners, conduct proceed with analgesics and start with antibiotic scheme. Pros and cons. Pros. Usually the results are good and the cysts often remain small and do not require treatment. Usually, when the surgery is performed, the problem does not reduce. In most cases, with physical examination, the lesion should be delimited in location, mobility, sensibility, definition, and consistency. Cons. There are usually no complications from the cysts themselves. A surgical excision procedure involves a small risk of the complications depending on where the cyst is located in relation to other structures. It can be said that the consequences of the cyst in the Gartner's duct that it can cause pain when the sexual act is performed or certain sports are practiced. Issue applied in Ecuador. Vaginal cysts represent a large percentage of the assistance to gynecological consultations in Ecuador. It is estimated that a large percentage of women attend the gynecological consultations for the different vaginal cysts in relation to the cysts of the Gartner duct. It is estimated that around 8 to 10% of the women attending the consultation are due to vaginal cysts. Conclusion. Gartner cysts, although infrequent, suggest that we consider a differential diagnosis of any other vaginal mass. This will allow us to perform a more adequate and safe treatment. Treatment depends on the symptoms it triggers. It usually surgical, and in all cases the differential diagnosis of other concomitant genitourinary malformations should be investigated. Thanks.